So let's discuss about the hypoglycemia associated autonomic failure. Our body has autonomic nervous system that is mainly responsible for fight or flight responses of the individual. And when the blood glucose level is dropped, then it affects that autonomic nervous system and how the person is responding to different situations which are in the fight or flight response. So if we talk about the first, we will discuss this autonomic failure as a result of hypoglycemia in two different forms. One is early type 2 diabetes mellitus, and then we will talk about the late type 2 diabetes mellitus and how it affects the autonomic responses. So early, when there is relative B cell failure or beta cell failure, then it causes marked absolute therapeutic hyperinsulinemia. So relative beta cell failure causes marked therapeutic hyperinsulinemia, and now we know that if there is insulin level is high, it causes drop in the blood glucose level. So there is falling of blood glucose level, and usually these types of early T2 or type 2 diabetes mellitus cases, they lead to isolated episodes of hypoglycemia. It's not repeated episodes of hypoglycemia. Once in a while, these individuals develop hypoglycemia. Next, when we talk about the advanced type 2 diabetes mellitus and type 1 diabetes mellitus, in which there is absolute beta cell failure, there is complete absolute failure of the beta cells, then there is relative or mild moderate absolute therapeutic hyperinsulinemia, decreased blood glucose level, then there is no insulin, decreased insulin, and no increased glucagon. Because there is absolute beta cell failure, these are the cells in the pancreas responsible for the production of insulin and glucagon, and when there is complete failure of these cells, there is no decrease insulin and increased glucagon response. As I mentioned in the pathophysiology, very, very important step to bring back the glucose level to the normal. And once this is not happening, then these patients usually have problem in bringing the blood glucose level back to normal, because the insulin is not decreasing and glucagon is not increasing as a response to decreased blood glucose level. There are episodes of hypoglycemia and attenuated sympathetoadrenal responses to hypoglycemia. I mentioned about this sympathetoadrenal outflow when we were talking about the pathophysiology of hypoglycemia and how body respond to the hypoglycemia, and when it's attenuated, it's not functioning, then the blood glucose level is not coming back to normal, and this can cause even in exercise, sleep, these conditions, it's attenuated, and we can have abnormal pathophysiological mechanism that can bring the blood glucose back to normal, and there is decreased adrenomedullary epinephrine responses, decreased sympathetic neural responses, and there is defective glucose counter regulation and hypoglycemic unawareness, and this can cause recurrent hypoglycemia. So one is relative failure of beta cells, One is absolute failure of beta cell. If you see in the relative failure, these patients usually have just isolated episodes once in a while, because their beta cells are capable of still responding to the decreased blood glucose level. But in other situation, the normal pathophysiological mechanisms are affected and they are attenuated, so normal responses are not present. In response to decreased blood glucose level, there is unawareness of hypoglycemic episode, and there is defective mechanisms for bringing the glucose level back to normal. So these patients have recurrent hypoglycemia, and these episodes of recurrent hypoglycemia can sometimes be very fatal and cause irreversible damage.